Welcome to another episode of Town Hall TV. I'm Nigel Allman, Non-Exec Director at the Town Hall Group, and I'm absolutely delighted to welcome Dr. Kam Chana to Town Hall TV. Welcome, Kam.
Thank you, Nigel.
We've got a little bit of your life to explore, I think, in the next 5 minutes or so, but can you just explain why you got into dentistry in the first place?
I think when I was at school, I always enjoyed the sciences, and as my A-levels went on, I found a natural leaning to kind of the healthcare side of things. And so I looked into various fields, optometry, medicine, and in the end, I found dentistry just sort of fitted me. I enjoy working with my hands. I used to do a lot of art and modelling. I did A-level art as well as the sciences, and I think it always struck me as something very practical, very enjoyable. I certainly couldn't do a desk job, and when I did my work experience, it just seemed to be the thing that gripped me. I found it very interesting, and hence I went into dentistry.
And having joined the Town Hall Group in sort of the last few years, what is it about Town Hall Group that you particularly enjoy?
Well, I'd known Imran and Rachel for many years. We worked together in the first practice, and I think we were together for about 6 or 7 years there. And then I went off into private practice, and then Imran set up the Town Hall practice, which then became the Town Hall Group. And at some point during that journey, he called me. We'd done a lot of post-grad work together. We had very similar mindsets about the kind of treatment we wanted to deliver, the level of service to patients, the quality of treatment, the way we wanted to practice dentistry at a very high level. And so he called me, he showed me the practice. I think at that stage it was just a couple of surgeries. He took me around and said, "Look, Kam, I need someone who is, on board with my vision." And it was a no-brainer. I fell in love with the practice and the team straight away. And so here I am. But, thoroughly love the environment we have here, love the team that we have, and just love how we can practice, the highest level of dentistry, really. So. And
can you believe the journey that the practice is on, given where you started with Imran?
It's quite incredible. Back years ago when we first started, we used to talk about the kind of practice we would love to build, to work in. And I think, a lot of people talk, some people pursue their vision. And I think Imran, has really followed that vision through. And the journey we've taken, even from when I joined, which was about 6 or 7 years ago, the things we've achieved, the way we have progressed as a practice, the way the team have driven the services that we offer, I think it's incredible. And there's still a lot more to come as well.
And that's the exciting thing about working here, isn't it?
Absolutely. We don't sit still. Nothing is ever, put to rest. We're always looking for the newest treatments, newest materials, the latest science, the latest research, and trying to implement it into the practice with really what we want to do is offer our patients the best possible services. So we won't stop. We'll keep going.
I'm sure our audience would love to know a little bit about you. So what outside of dentistry, and when you get a chance to be yourself, what do you like to do? What are your interests?
Well, when I do have spare time, which not that often these days with a young family, I still enjoy doing a lot of artwork, still enjoy painting. I have a drum kit at home, possibly a midlife crisis, but it's always something I'd wanted to do. And a few years ago, we had the space to have a drum kit in the garage, so I really enjoy drumming. Really enjoy watching films, world cinema, and we do a lot of dental postgraduate studies. And for a break, I actually did a film studies course as well. So it's something I really enjoy watching, studying films, not so much for entertainment, but almost as a work of art. So that's a big chunk of my time.
Fantastic. We might see you behind the camera, or not, as the case may be in the future.
I'll stick to drilling teeth, I think.
So, are we going to get this chance to see you drumming in the future? Is that going to be something that you're going to expose the team to?
Expose, inflate might be a better word. But no, there are plans when lockdown has ended to get together with a friend who plays guitar to get a kind of a two-man blues band together, which we hopefully one day we'll stop talking about it and actually do it.
Kam, it's been a pleasure. A little too brief, I'm sure, but I'm sure we'll get a chance to talk again. Thank you for your time.
Great. Thanks very much, Nigel.